Welcome to today's video about common medication-caused dementia. Could the pills you take every day be silently damaging your brain? Have you ever wondered if a common medication could increase your risk of memory loss or even dementia? Here's a shocking fact. According to recent studies, over 50 million people worldwide suffer from dementia. But what if I told you some medications prescribed for everyday issues could be a hidden culprit? Which medications are the riskiest? Are you or your loved ones unknowingly at risk? And what can you do to protect your brain? Stay with me, because in this video, we'll uncover the most common medications linked to memory loss, explain the science behind it, and share tips to keep your brain sharp and healthy. You might be surprised, some of these drugs could already be in your medicine cabinet. So, are you ready to discover the truth? Let's dive in. Just a quick reminder, the information provided in this video is for educational purposes only and is not intended as a substitute for professional medical advice. Please note, every piece of information provided here has been thoroughly verified by a team of professional researchers, ensuring accuracy and reliability. All research references are included in the description. All right, let's break down the medications that could raise your dementia risk, beginning with number 1. Anticholinergics. Anticholinergic medications function by inhibiting acetylcholine, a neurotransmitter essential for cognitive processes such as learning and memory. This inhibition can lead to cognitive impairments, particularly with prolonged use. A recent study published in BMJ Medicine in November 2024 examined the association between anticholinergic drugs prescribed for overactive bladder and the risk of dementia. The research analyzed health records from over 1 million individuals aged 55 and older in England. The findings revealed that the use of anticholinergic medications was linked to an 18% increase in the likelihood of developing dementia. Notably, specific drugs such as Oxybutynin hydrochloride and Tolterodine tartrate were associated with a 31% and 27% higher risk, respectively. The study underscores the importance for healthcare providers to carefully consider the long-term cognitive risks when prescribing these medications and to explore alternative treatments when feasible. Next, number 2. Benzodiazepines. Long-term use of certain medications has been associated with an increased risk of developing dementia. For instance, a study published in the British Medical Journal in 2012 found that new use of benzodiazepines was associated with an increased risk of dementia. These medications enhance the effect of the neurotransmitter gamma-aminobutyric acid, leading to sedative and anxiolytic effects. However, prolonged use can result in cognitive impairment, including memory problems and decreased attention. The exact mechanism is not fully understood, but it is believed that long-term benzodiazepine use may lead to neurodegenerative changes in the brain, increasing the risk of dementia. Therefore, it is important to use these medications only as prescribed and to discuss any concerns with a healthcare provider. Next, number 3. Antipsychotics. Recent studies have highlighted a concerning association between antipsychotic medication use and an increased risk of developing dementia. A 2024 study published in The Lancet found that individuals exposed to antipsychotics had a higher likelihood of developing dementia, with a clear dose-response relationship observed. This means that higher doses and prolonged use of these medications correlated with a greater risk. The study emphasized the importance of raising awareness among healthcare providers and patients about this potential risk to encourage more cautious prescribing practices. The mechanisms underlying this association are not yet fully understood. However, it's hypothesized that antipsychotics may contribute to cognitive decline through several pathways. For instance, some antipsychotics possess anticholinergic properties, which can impair acetylcholine function, a neurotransmitter crucial for memory and learning. Additionally, these medications can lead to metabolic side effects such as weight gain and insulin resistance, which are known risk factors for cognitive impairment. Furthermore, antipsychotics have been linked to an increased risk of cerebrovascular events, like strokes, which can directly impact cognitive function. Given these potential risks, it's essential for clinicians to carefully evaluate the necessity of antipsychotic prescriptions, especially for older adults, and to consider alternative treatments when possible. Next, number 4. Proton pump inhibitors. It's intriguing how certain medications, like proton pump inhibitors or PPIs, might influence our brain health. PPIs, commonly used to treat acid-related disorders, have been the subject of studies exploring their potential link to dementia. One proposed mechanism involves the inhibition of the enzyme choline acetyltransferase, which is crucial for the synthesis of acetylcholine, a neurotransmitter vital for memory and learning. By inhibiting this enzyme, PPIs could potentially reduce acetylcholine levels, thereby impairing cognitive function. A study published in the journal Neurology in 2023 found that individuals who used PPIs for more than 4.4 years had a 33% higher risk of developing dementia compared to non-users. This finding underscores the importance of cautious long-term use of PPIs and highlights the need for further research to fully understand the relationship between these medications and cognitive decline. While these insights are compelling, it's essential to consult with healthcare professionals before making any changes to medication regimens, as the benefits and risks can vary based on individual health profiles. Next, number 5. Antidepressants. Antidepressants are commonly prescribed to alleviate symptoms of depression, anxiety, and certain chronic pain conditions. However, there's ongoing discussion about their long-term effects on cognitive health. Some antidepressants, particularly tricyclics, possess anticholinergic properties, meaning they block acetylcholine, a neurotransmitter crucial for memory and learning. This blockade can lead to cognitive impairments, especially in older adults. A 2023 meta-analysis published in the Journal of Clinical Medicine examined the relationship between antidepressant use and dementia risk in older adults with depression. The study found that antidepressant use was associated with an increased risk of dementia in this population. The authors noted that moderate to high heterogeneity existed across studies, suggesting that future work accounting for depression progression is needed to differentiate the effect of depression and antidepressants on dementia risk. It's essential to recognize that while these findings highlight a potential association, they don't establish a direct cause and effect relationship. Depression itself is a known risk factor for cognitive decline, and the interplay between depression, its treatment, and dementia is complex. If you or someone you know is concerned about the cognitive effects of antidepressants, it's advisable to consult with a healthcare professional to weigh the benefits and risks tailored to individual health needs. Next, number 6, anti-epileptic drugs. Anti-epileptic drugs, or AEDs, are primarily prescribed to manage seizures in individuals with epilepsy. They function by stabilizing neuronal activity, often through mechanisms such as blocking voltage-gated sodium channels or enhancing gamma-aminobutyric acid, GABAergic neurotransmission. However, there's growing concern about the long-term cognitive effects of certain AEDs. Some of these medications are known to impair cognitive function, which refers to various aspects of information processing. A study from the University of Eastern Finland and the German Center for Neurodegenerative Diseases found that continuous use of AEDs for periods exceeding 1 year was associated with a 15% increased risk of Alzheimer's disease in the Finnish dataset and a 30% increased risk of dementia in the German dataset. Notably, the risk was higher with AEDs known to impair cognitive function, showing a 20% increased risk of Alzheimer's and a 60% increased risk of dementia. The exact mechanisms underlying this association remain under investigation. It's hypothesized that AEDs affecting cognitive function might contribute to neuronal changes that predispose individuals to dementia. This highlights the importance of regular cognitive assessments for patients on long-term AED therapy and underscores the need for healthcare providers to carefully consider the cognitive side effects when prescribing these medications. Next, number 7, antimuscarinics for overactive bladder. Overactive bladder, or OAB, can be quite disruptive, leading many to seek relief through medications. One common treatment involves antimuscarinic drugs, which work by blocking specific receptors in the bladder to reduce frequent urges. However, these medications don't just target the bladder, they can also affect receptors in the brain. This unintended action may interfere with cognitive functions like memory and learning. A study published in the Brazilian Journal of Medical and Biological Research in 2022 highlighted this concern. The researchers found that prolonged use of bladder antimuscarinics was linked to a higher risk of developing dementia. They emphasized that the risk increased with longer durations of use, suggesting that the cumulative effect of these drugs on the brain could be significant. Given these findings, it's essential for individuals using antimuscarinic medications for OAB to have regular consultations with their healthcare providers. Discussing the duration of use and exploring alternative treatments can help manage bladder symptoms while minimizing potential risks to cognitive health. Next, number 8, sedative antihistamines. Many individuals turn to first-generation antihistamines, like diphenhydramine, commonly known as Benadryl, to alleviate allergy symptoms or as occasional sleep aids. These medications work by blocking histamine receptors to reduce allergic reactions. However, they also inhibit acetylcholine, a neurotransmitter vital for memory and learning. This anticholinergic effect can lead to cognitive issues, especially with prolonged use. A study published in JAMA Internal Medicine in 2015 highlighted that extended use of strong anticholinergic drugs is linked to a higher risk of dementia. Specifically, taking such medications daily for over 3 years was associated with a 54% increased risk compared to shorter durations. Given these findings, it's essential to use sedative antihistamines cautiously, particularly among older adults. Exploring alternative treatments with fewer cognitive side effects and consulting healthcare professionals about long-term medication use can help mitigate potential risks. Next, number 9, opioids. Managing chronic pain often involves the prescription of opioids, potent medications that, while effective for pain relief, have been linked to cognitive decline. The exact mechanisms remain under investigation, but it's believed that opioids may contribute to neuroinflammation and the accumulation of proteins such as beta-amyloid and tau in the brain, hallmarks of Alzheimer's disease. A study published in JAMA Network Open in December 2024 found that individuals with cumulative opioid use exceeding 90 total standardized doses had an elevated risk of developing dementia before the age of 90. This association persisted even among those using opioids solely for chronic non-cancer pain and those exposed only to weaker opioids. These findings underscore the importance of cautious opioid prescribing and highlight the need for further research to determine whether opioids directly contribute to dementia risk. Next, number 10, glucocorticoids. Glucocorticoids, commonly prescribed for conditions like asthma, arthritis, and autoimmune diseases, are powerful anti-inflammatory agents. However, their prolonged use has been linked to cognitive impairments, a phenomenon sometimes referred to as steroid dementia syndrome. This condition is characterized by deficits in memory, attention, and executive function. The underlying mechanism involves glucocorticoids binding to receptors in the hippocampus, a brain region integral to learning and memory. Chronic exposure can lead to neuronal atrophy and reduced neurogenesis in this area, resulting in cognitive decline. A 2019 study published in the journal Frontiers in Neuroscience highlighted that prolonged glucocorticoid treatment is known to cause cognitive deficits, typically characterized by impairments in declarative memory, processing speed, and concentration. Given these potential risks, it's crucial for patients and healthcare providers to weigh the benefits and drawbacks of long-term glucocorticoid therapy. Regular monitoring of cognitive function and exploring alternative treatments when possible can help mitigate these adverse effects. Next, number 11, non-benzodiazepine sedatives. Medications like zolpidem, isopuclone, and zaleplon are commonly prescribed to help individuals struggling with insomnia. They work by enhancing the activity of gamma-aminobutyric acid, or GABA, a neurotransmitter that promotes relaxation and sleep. This action helps users fall asleep more easily and maintain sleep throughout the night. However, there's growing concern about the long-term use of these sleep aids. A study published in PLOS One in 2018 found that individuals using sedative hypnotics had a higher risk of developing Alzheimer's disease compared to non-users. The exact mechanism isn't fully understood, but it's believed that prolonged use may lead to changes in brain chemistry or structure, potentially increasing the risk of cognitive decline. Given these findings, it's essential to use these medications cautiously. If you're considering or currently using them for sleep issues, it's a good idea to discuss the potential risks and benefits with your healthcare provider. Next, number 12, antiemetics. Medications designed to combat nausea and vomiting, known as antiemetics, are commonly prescribed for conditions like motion sickness, vertigo, and the side effects of chemotherapy. However, some of these drugs possess anticholinergic properties, meaning they block acetylcholine, a neurotransmitter vital for memory and learning. This blockade can lead to cognitive impairments, especially with prolonged use. A comprehensive study published in the Journal of the American Medical Association examined the link between anticholinergic drug exposure and the risk of dementia. The researchers found that higher cumulative use of these medications was associated with an increased risk of developing dementia. This association was particularly strong for certain classes of anticholinergic drugs, including some antiemetics. Given these findings, it's essential for individuals and healthcare providers to weigh the benefits and risks when considering antiemetic treatments, especially for long-term use. Exploring alternative therapies with fewer anticholinergic effects may be prudent to safeguard cognitive health. Next, number 13, muscle relaxants. Muscle relaxants are commonly prescribed to alleviate discomfort from muscle spasms, strains, or injuries. However, some of these medications possess anticholinergic properties, meaning they interfere with acetylcholine, a neurotransmitter vital for memory and cognitive functions. This interference can lead to cognitive impairments, especially with prolonged use. A study published in the Journal of Alzheimer's Disease in 2022 examined the relationship between muscle relaxant usage and the risk of Alzheimer's disease. The findings indicated that higher exposure to certain muscle relaxants, particularly orphanadrine, was associated with an increased risk of developing Alzheimer's. The study concluded that individuals with greater cumulative use of orphanadrine had a higher likelihood of Alzheimer's onset. Given these insights, it's essential for patients and healthcare providers to weigh the benefits and potential cognitive risks when considering long-term use of muscle relaxants. Exploring alternative treatments or using the lowest effective dose for the shortest duration may help mitigate these risks. Next, number 14, antispasmodics. Medications known as antispasmodics are commonly prescribed to alleviate muscle spasms in the gastrointestinal tract, bladder, or other smooth muscles. They work by relaxing these muscles, providing relief from conditions like irritable bowel syndrome or overactive bladder. However, there's growing concern about their long-term impact on brain health. A study published in the BMJ in 2018 highlighted that prolonged use of certain anticholinergic drugs, including some antispasmodics, is linked to an increased risk of dementia. The research indicated that the risk escalates with higher cumulative doses. It's believed that these medications interfere with acetylcholine, a neurotransmitter vital for memory and learning. By blocking acetylcholine's action, antispasmodics may inadvertently contribute to cognitive decline over time. Given these findings, it's essential for individuals, especially older adults, to consult with their healthcare providers. Discussing the necessity of continued antispasmodic use and exploring alternative treatments can help mitigate potential risks to cognitive health. Next, number 15, anti-Parkinson drugs. Managing Parkinson's disease often involves medications that enhance dopamine activity in the brain, aiming to alleviate symptoms like tremors and rigidity. However, some of these drugs, particularly those with anticholinergic properties, have been linked to an increased risk of dementia. Anticholinergic medications work by blocking acetylcholine, a neurotransmitter crucial for memory and learning. This blockade can lead to cognitive decline, especially with prolonged use. A study published in the International Journal of Molecular Sciences in 2024 highlighted that among anticholinergic drugs, Those prescribed for Parkinson's disease, urological issues, and depression showed a pronounced association with dementia risk. Examples of anti-Parkinsonian drugs with anticholinergic effects include benzodiazepine and trihexyphenidyl. While these medications can be effective in managing motor symptoms, it's essential to weigh their benefits against potential cognitive risks. Patients and healthcare providers should engage in open discussions to carefully consider treatment options, monitor cognitive health, and explore alternative therapies when appropriate. That's it for today's video. Did you find this information shocking and helpful? I sure hope so, because what you do next matters. Now, it's your turn to share. Are you or someone you know taking any of these medications? Have you noticed changes in your memory or focus? Don't hold back. Share your experience in the comments below. Your story could help someone else. If this video opened your eyes, type yes in the comments. It's quick, easy, and truly motivates us to create more life-saving content just for you. Thank you for being part of this conversation. Don't forget to like, subscribe, and hit the bell icon to never miss an update. Together, let's stay informed and protect our health. See you in the next video.